test. Can you see it?
Yeah, well, so I'm Suzy Antoun. I do eyes and ears. This is my card if anyone wants. So I test eyes and I test hearing. Yeah. So anyone will need any help, please, you can grab a card. But here is, like a simple eye test. Can you read it, please? Can you see it?
Yes, E, yes, C, ear.
Can you read it?
Under that, E.
No, read from the top.
Okay, E, yes, 2C.
Can you read it?
E, yes, 2C, E, 2H.
Can you read it, Jacinta?
Okay. Eyes to see, ears to hear, seeing and hearing God's will for our lives.
How is that? Isn't it that better reading? So here is what we're talking about when you do eyes and ears. You need to make people see. And when sometimes you give the glasses to the person first time, you look at the glasses. You have to be convinced you're happy here, then the vision work for you. Same thing for the hearing. People deny their hearing problem, but they come, I cannot see. So because we do those two business, it's a bit interesting. So you can really read it as yes, whatever, but someone else. Yeah. So our job here, I don't know what you guys doing, but I know that you can change the concept of life if you change how they see. Always point to something good in their life. If you're capable to make that shift, they come and say, I had a stroke, 4 strokes. I said, all right, and then start to swear on God. And then I said, he saved you. The moment that he changed his vision, how he sees things, he started to be able to get whatever he's passing through in a different way. So I know that I'm not here to teach you about this, but here is the main thing. We can shift the way the people see things. So now we're going to do the hearing test again, the eye test again. Another one. I'm not going to get Jacinta. She's so smart. I went with her into the primary first aid, and she was just brilliant. We'll leave it in the end. Right. So what happened here? If anyone wants to come and see my pictures, yeah, but let me make it bigger. She asked me presentation, but
Yeah, sorry, I didn't have my hands.
just go for the big one.
Yeah.
Oh, sorry.
Yeah, here we go. I'll sit it here for you.
Right.
There you go. There's our presentation.
Okay. So it's not moving what? All right. Well, I got one of these in my clinic. So this is like you guys all see. So this is a section of the eye. Yeah, and if you look at this picture here, what's the difference between seeing and not seeing is how the rays of the light can fall on the retina, the nerve part of the eye. So you can see like the light here is falling in front of the retina. This is short-sighted. Falling behind the retina is long-sightedness. Both of them need to be corrected to put glasses to make them fall on the retina. This is the work of the optometrist. Here we get, you need all to see. Clear?
I'll pass it around.
No, if they can see, that's it. Because
Okay.
I don't want to take much of their time at this presentation, but we need to see and to see clear. And sometimes, we think we see in the eye, but even in anatomy and when you study medicine, you see in the brain how your brain is. You see when you see in your brain, in your heart, like we start in the beginning. So you can see clearly now. This is what we're all trying to achieve. Now there is, after 43 types of vision. People are not aware of this very much. When you're young, under 40, the muscle of the eye works this little muscle here, very active, all the time at different light, different distances, and you can see. You hit the 40, if you had a good vision, not an error before then, you start to develop problem with reading. And your arms are not long enough, the light is not bright enough. We need brighter light as we get older, like really maybe 3 times more. So you guys go and don't think they are in their 20s if you deal with old people. So here we have a distance vision, and then we started to have the reading fading, but then the intermediate fade after that. So intermediate, so the 3 parts, is the 40, 44, 45. you need to correct the reading only. 46, 47, you start to need an intermediate correction. So here, single vision. I'm going to go for the lenses first, and if we have a little bit time, we can speak about the diseases. And I get you this, and I want every one of you try this, because this is how the patient sees. Different diseases, name is there, and you can put them and see how your patient sees. All right, so the single vision is one lens. You can see either far or you see near, not like the young ones. Over 40 have different distances. Now they start, or years ago, the bifocal is the line, of course you all know, the line reading on the bottom and far. There was another lens a few years ago called Trifocal with two lines, so the intermediate is in the lens. And now this one is very ugly looking, so they don't do it anymore, and they started to have the multifocal. Can you see the picture? I want you guys to pass this, and if you want to have a copy, you can have. So this is here giving you your distance vision. This part of the lower part is your computer and reading. So it's good for distance because it shows you far, but this lower part, computer and reading. It's not like this lens everywhere you can see the same, sleeping on the couch, in the bed, you can read. Multifocal have a protocol that you have to do in it. But now I just hear people, oh, don't give them bifocal because they will fall. I heard Jacinta say that one time, and I pass it because I would encourage you the opposite way around. As younger as you get the brain trained, it's easier. I was working a few years ago with center with dementia and Alzheimer. It was very heavy place. But see here, when you eat, everything is blurry. It's not your far vision anymore. So everything around you here is fuzzy. I will encourage the one who are multifocal, whatever, take your glasses off and see how is the difference between seeing close here and not seeing. You're not 20, you're not 30 anymore, you're not 40 anymore. So you train them. I was giving into that heavy place of, Alzheimer and whatever, a bifocal first time or whatever, because I know they will appreciate when they eat, they see all what they need here. Bifocal is easy, cheaper, easy, reading, close, far. The intermediate is another place when you can see more computers and other things. So this is the three lenses. Of course, there is lens computer reading, but for the simplification and your time, this is how the multifocal, the sides are fuzzy. Sides are fuzzy in the center. So you train your patient or the person to look straight and encourage them to have younger age, the more difficult. When I feel like the optometrist left them with two pair of glasses, far and near, I feel these people were robbed. No one will carry two pair of glasses ever. This is very uncomfortable. So they go by the one they need most. They have an error or they have one eye, so the one that they cannot really see, they carry, the other one is not. So for you to equip a person, you never know he's aging, you don't know what happened to him in 10 years' time, give him the combined lens because it's easier. It's all about distraction here. That's for the multifocal. For the bifocal, it's very easy. You drop the glasses a little bit lower. So when they walk and they have a problem walking, because this is what I understand we're talking about, you just drop the glasses a little bit or take them off. But don't deprive them from having most of their vision back, because this muscle is not working for them anymore. And there is the glasses if they read. Well, the multifocal is easy. Use your nose. I want to see you. You're blurry, you're clear. Then in the beginning, you will see that kind of fuzziness on the side. But after using the multifocal for a while, you will not feel any difference. You don't feel a difference. So don't postpone it, don't put it later, because it's vision. We need the three vision. Cannot speak more and take more of your time, but it's like multifocal is you have three pairs in one. Bifocal is you have two. If you have a clever optometrist, can give you bifocal with three vision. You pay less, you have the three vision, but it has a technology to do it. Now there is other things that we put in the lenses, because here are those people on aging. They have difficulty seeing. So we have the anti-glare. I have a good picture. I couldn't really get a good picture for you guys here, but you can see here this one. Difference for the reading, and here, you can see the one which is good, the one which is not good. I call the anti-glare. for the reading as well, for the look. And it's not that expensive, but it's variable on aged people. Aged people need to sharpen their vision as much as you can. And this is an anti-glare. And the transition now. We are in Australia with the ozone problem. We're more exposed to the sun and the hurting of UV than other nations. So really, 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 it's an asset. It's just an investment to do for your health. Go anti-glare, go transition. Don't think it's a loss of money or it's more expensive. It's a valuable gift to yourself or to the patient. Now I try to get this picture. So this is a transition. There is new transition now. We can really, really go dark even in the car. So now we're talking about the presbyopia. We're talking about aging group. There is few things that people develop. Like I said, the pupil, which is if you have green eyes, so that center black part in the middle is called the pupil, black, and the blue eyes is more clear or green. This is not working as good as anymore, and this is like the muscle working for the light, to increase light or to reduce light. So let's say you see someone, customer or patient you see first time, whatever, and you see his eye is like pinpoint, very small in the night time. This is not right. Because in the night time, it open wide to get more light. If the opposite way around, So I'm going to show you. Sorry, what did you do? Just hit here.
I'm trying to make it brighter.
How do you make it bright?
I'm just trying. I
alright.
think I skipped too far ahead. Sorry. I was trying to be helpful and I ruined the presentation.
No, well, you never ruin my presentation, Mina. All good. So we're talking here about the pupil, the size of the pupil. Go higher. All right. So this is, leave this one. So this is here the bifocal. Something that you may notice, guys, I don't know if you cannot see it, but it has a line. You have to make sure that that line is not too high. It's on the lower lid of the patient. If it's too low, then he don't read much. If it's too high, it's gonna fall like Jacinta was talking about. So this is important for the bifocal, that you see where is that line with the sight of the people that you. So we talk here about this pupil size. We talk about this muscle, that little one that you may not really aware of it, but it works down with every distance you're looking at. I look at you, and here this muscle work all those distance. Different light, work. All the time. Get fatigued by the 40s. That's why we replace it by plus lenses, which are reading glasses. The other thing is pupil size. Yeah. Like I said, like bright surface, we can drop this one. Okay. So this is here like a design. Can you see this picture, guys? The design of the multifocal, of course, is progressing and getting better as the technology go better and better and best. But really, the cheap multifocal, you don't put money in it. It's no good. Because you're gonna restrict, the reading part and the computer part, and you will hate it, and you will be locked into single vision, or one glasses for this and one, you rub yourself. So multifocal, the widest, the brain is important. How you invest in your health is just falling and seeing, enjoying reading, enjoying life. Otherwise, this is not a part that you save in. Now this look like a picture of a normal healthy eye. So is there any question about lenses? Because then I'm gonna touch quickly about disease. You guys are, but why are we doing this? First of all, the optometrist was a profession, was resisted for a long time. Ophthalmologists and doctors don't want to refer to them, whatever. But the position of the optometrist, which even I don't have it in my country back, we have all ophthalmologists over there, but here, optometrist is like the first aid, like the doctor. You don't go to a specialist. Do you go to a specialist? You go to a GP and he referred you. Same thing with the optometrist. The government is funding more of the tests, they cannot pay, they should not pay for it. You go to the specialist for every test you do, pay. Optometry now is very highly equipped. We have most of the equipment that they have on testing. The problem of the eyes is every single thing needs a machine. Money, because for front of the eye, there is special people different from the back of the eye. Every part of the eye has a machinery and the equipment that you have to test with them. So it's kind of very expensive. But they are the freer, the cheaper way. You don't jump on the ophthalmologist before go to the optometrist. He will do field of vision for glaucoma for free. He will do, all the tests, the pressure test, all those things. No dollar. Your Medicare is covering for it. So don't despise it. Even GP don't like to refer, except they don't want to take responsibility of, driving license, whatever. He's too old. But apart from that, it's a place where really it's safe that you can go. These people, they train them very high. And I'm an ophthalmologist, like she said, and I'm saying that from a real place. So this is here a section of the eye. This is your lid. This is a normal eye look like. You can see something like that in the eye of someone and you get, oh, that's very scary. This is not scary. But I'm going to show you what is scary. Anything of here, I'd like you guys come and have a look on this. And if you want to have a picture, because this cannot be copied with your mobile, whatever. These eyes, you do not really rest on it. In a pupil like this, white here, refer straight today, you have to go to see the optometrist. Of course, something like that, very scary. Eyes like this, very pink and rosy, whatever, no good. This is a place where you really have to go and don't give it for tomorrow. We can save eyes by seeing the people as soon as, and it's not cost you anything. Yeah, like I said, we have a lot of machinery to measure things. A person comes with a floater or flashes of light. You can see that more often on the age group. So what's happening here? It's in here. The jelly of the eye start to shrink or start to change nature, and it's not anymore jelly. So it's not stick to the retina, to the back of the eye. It's hanging around. And when you do that, you can see floaters, or by with the pulling on the eye, you can see flashes. This can be serious or can be not serious. Who can decide? If you say this, I see those floaters for whatever many months or whatever, it's probably not the bad one. So the retina is detached. The vitreous, the jelly is detached from the retina. But it's detaching without pulling the retina and producing retinal detachment, which means vision loss, big loss. So here, guys, it's important for you if you see some. They complain of floaters, floaters, black spots, flashes. I see flashes. Don't ignore it. Because between saving an eye from being blind or recovering to the minimum to an eye who can see, it's like that. They can be seen on the same day and take it serious. Flashes and floaters, very common on old age.
They say they could see flashes of those straight away, see an optometrist.
Yeah, at least an optometrist costs them nothing.
Yeah.
Medicare will pay.
What's the second one called?
The retinal detachment.
No, the doctor.
Or the ophthalmologist.
Ophthalmologist, the eye specialist.
Yeah, that's an eye specialist.
I don't think you can go straight to the ophthalmologist.
You can't, you
You
can't.
have to
The
get referred to.
optometrist has to give you
Yeah,
a
but the
referral.
optometrist can tell if this is something, like really serious and refer on the same day or whatever. But you don't take it lightly. A floater, a flashes. It's not jokes.
What is that?
GP can refer.
Can you refer? That's what they're asking.
The optometrist refer will give all details with the history, with what he found.
so
Not like the doctor, he's blurred vision and refer. That's all what he can say, read the chart. Like my girls here couldn't read the chart.
What if they have diabetes?
We're gonna go for that right now. All right. So here we're talking about the glaucoma. This is another name, probably you know. It's very, very important because what is glaucoma? It does not affect the vision. You can see the same. It's cutting the side of the vision, and people will not know. By having the vision reduced like this, you lost a lot. And the problem is just drops in the night. Not big deal. Of course, there is cases which are really more resistant, but I mean, just putting one drop in the night and reduce and saving an eye, saving life. So what happened here? There is pressure. These places is where the fluid around the eye circulates. Get a little bit like blocked, or not as like the sewage, when it's blocked. And I make a pressure, and what the point of pressure will be on the optic nerve. On the optic nerve here. And when this happens, pressure in the eye goes. It's a balloon which is solid, there is no place to go, and now you're like, it's full. That's the pressure on the eye. Pressure on the optic nerve, kill the optic nerve slowly, and people will not know. person look like that, you should not really ignore it because you can see it. Can you see that he's staring and his eyes like out? Am I too long? This is like a thyroid problem and it's treatable because this person, his eyes will never reflect back. Problem of all those things is like we can define how much of vision on the side that they lost or they still have. We can rescue those eyes. And it can be a simple thing that you notice. Oh, why is she looking like, she scared me. No, she's not scaring you. She is developing thyroid problem, need to have an attention, and you can just tell her, can we see the doctor? Saving people, you are into a place when you can, sorry? It happened gradually and the eye bulge, but it never go back. After the treatment, it never go back. So this is some like disfiguring thing. And it's very easy, get the tablets of the thyroid. Thyroxine is not a problem. It's treatable disease and you guys can see it. But just to have a look, see how we saw it's WES. But no, you can see more because you can train to, you see more people, you see different. I don't know, I don't like about that person because he's doing that to you. And that thing is a disease. You know, just, open your eyes and see and connect with people. You are into a place where their family probably not around and you just like the mercy of God in your heart. So use this. This is here the field of vision can be tested and we can see like a lot of losses there, irrecoverable. People with, I just want you to do a simple test. Can I do it with user center? Take the head, please. So what you're gonna do is very simple. You may not really, no, give me your face to me. So what we're gonna do, just cover one eye and I want you to see when is, you see my finger?
Yeah.
You see it?
Yeah.
All right, as this hard, cover the other side. Very simple, right? But you see that person keep bumping into things. Why? Because he has a restriction vision. So just, you see which eyes you see better, whatever. Can you see, put your finger in the middle and you can, this is the problem here. That's why you keep bumping, this is why you keep falling. It's all about eyes, Not all about eyes, but main things. People don't see, they're gonna fall. Right, so I don't want to take much of your time, but this is maybe last thing, and you guys, diabetes, of course, diabetes is a major problem, doing damage, eating the eyes, kidneys, very interesting. It's the only place when you can see the blood vessels, the real one, when you go and have a retinal photo. It's real blood vessels in front of you, real optic nerve. You can see that, and it can tell you about the condition of the kidney, how it's functioning. So people with bad diabetes, not only it show in the eye, it show the condition of the kidney. So we can tell a lot about blood pressure by seeing the back of the eye. So that's like you send the patient to the GP of the eye. As simple as that. Dry eye is very big problem on aged people because, dryness of the air, the sun and all that. So if it's one eye, they just do a little bit of massage here because it may be a block into the tear taking to the nose. Maybe you can just put one drop and see if they feel it or not in one side. Then if you not feel it, it's blocked. As simple as that, but there's a lot of pharmacists, products from over the counter that you can have. Need to re-wet the eyes because we have air condition, we have heaters, we have all those things all the time. So guys, I'm gonna pass this. And I couldn't put it here. Didn't have time to do it. It's from my clinic here. This one and this one kind of similar, but you can read the disease here. This is an eye condition. That's a normal vision. Pass it and see how your patient can see, and wonder why this poor thing keep falling and having this. But identifying that a person with a stroke cannot see on that side, this is very simple, as you saw. Very simple. You close your eyes the same and see how much your patient can see on that side or that side, because he needs help on that side more than that side. That's for the stroke problem, or for the glaucoma, the same thing. But here is macular degeneration. The macula, which is the center of the eye, is blurring vision here. This is diabetic retinopathy. You're asking about diabetes, how it turns your vision to such thing. Horrible. And this is the cataract. Cataract is all blurry. It's like a dirty window. You can throw a dirty window and people has to wait at least for 2 years to have an operation done. So this is something really, it has to be held by people like you guys doing that work, because they will have to 2 years until they will have that turn for the cataract. This one is, like I said, the people with stroke, half of the picture is gone. Half. No jokes. What do you want that person not to fall or feel equilibrium, whatever? I just want you to try this. This is how that disease look, this one. And try them for yourself, pass it down, and you will feel how your patient can feel. And maybe you can help them by the mercy. Yeah? So now back to my this. And Jacinta will be the last one to read it.
The eye is the lamp of the body. If your eyes are good, your whole body will be full of light.
How is that? Yeah, this is Bible verse. I believe you're Catholic guys. But see here, it's lamp for the body. You can see a lot. When you turn the person to see the goodness of God, see, he's not lonely because family are not there. They can have friends. You turn a life to another better life. And I see that every day in my clinic. Thank you, guys.
Are there any questions about eyes or lenses or?
Where is your clinic?